Welcome in. Doris, if you can share the screen of the slides, that would be great. Welcome in, everyone. Hi, welcome. Welcome to joining us. All right. I will just have our started. So, hi everyone. My name is Anita Feng. I use she, they pronouns. I am the student engagement coordinator here at ISSS. Welcome to our webinar as you get ready for the spring semester. We're so excited to have you join us. And from our survey, we know health and well-being are top concerns for our international students. And maintaining both your physical as well as mental health is essential for success at the university. We understand US healthcare can be a little bit complex, so we have invited our campus partners to guide you on navigating health resources as well as services. So today's session will provide clear steps to help you thrive. To kick us off, I will pass it on to Barbara Kapler, the Assistant Vice Provost as well as the Director of International Student and Scholar Services, aka ISSS, to do a general welcome.
Welcome, everyone. I am Barbara Kapler. I am Director and Assistant Vice Provost of International Student and Scholar Services, or as we like to say, ISSS. I believe our office is incredibly lucky. We get to work with all incoming and ongoing international students and scholars at the University of Minnesota. It's a wonderful time in Minnesota. We've got bright, sunny skies, great winter weather, and we look forward to welcoming you on campus and seeing you soon. These global Gopher experiences are an excellent way to begin your time at the University of Minnesota, and I think you're very wise to be in this space today. You're going to have opportunity to learn from staff who have deep expertise on these topics and can be sharing information with you that is helpful now as well as into the future. It's also going to be a time to learning resources and excellent ways to take advantage of all that is there at the University of Minnesota in support of your own well-being. I want to mention with ISSS that we know it's a great campus. We also know it's an incredibly large campus and takes a while to get to know resources. And so we want you to certainly reach out to ISSS when you have questions that are directly related to you as an international student, but also reaching out when you have questions about where to go on campus and be using ISSS as a resource to help you get accustomed and familiar with all that there is to offer you. Before passing it along, want to thank the staff who worked hard to prepare today's program, including our student staff. We're really fortunate in ISSS to have an excellent team and fantastic partners that you'll be meeting today. So with that, I look forward to today's session and we'll pass it on to one of our great leaders, Amora, who is an undergraduate student leader, and she'll do an overview of the webinar. Thank you all.
Thank you, Barbara. Hi, everyone. My name is Amora Patbayar. I'm a Senior Supervising Global Experiences Leader at ISSS, and today I'll be going through the overview of the webinar. So this webinar is being recorded and it'll be posted on the ISSS website. So we recommend you using the gallery view or speaker. So general information will be provided during this webinar, and we expect that you may need to reach out to an office about a situation-specific questions. In the first hour, will be panelists introducing themselves and reviewing general information related to health and wellness. Our partners include Boynton Health Services, Office of Student Health Benefits, Blue Cross and Blue Shields of Minnesota, and Office of Housing and Residential Life. And in the last 30 minutes, it will be a question and answer session with the common pre-submitted questions during the registration. So ISSS staff will be joining us for this portion as well. Questions can be submitted via the Q&A function, and this Q&A function is located at the bottom of your screen, so you have the ability to submit questions anonymously. Now I would like to introduce Katie Olson-Williams from Housing and Residential Life, sharing about housing information.
Thanks, Amora. Hi and welcome. My name is Katie Olson-Williams. I use she, her pronouns, and I'm an assistant director here in Housing and Residential Life. Housing and Residential Life provides housing to over 7,400 students on the Twin Cities campus in 17 buildings located on the East Bank, West Bank, and St. Paul campus. We provide opportunities for students to meet others and have staff on site as a resource and for crisis response. In addition, we have almost 40 unique living learning communities where students live in a community with others that share the same academic goals or personal interests. Move-in for new spring residents to our apartments began on January 7th and continues, and for traditional residence halls on January 18th. If you have not yet found housing, we are still accepting applications, which you may find on our website. If you do plan to live with us, please be aware of your housing contract terms. I also encourage you to review our website related to roommates to assist you in your transition to living with someone else. If you have any issues with your roommate, please ask for help early. Next slide, please. So your health and safety is important to us. These pages provide some information for you to be aware of, as it is all of our responsibility. We no longer have any specific protocols for COVID. However, our website has resources available if you have questions about what to do if you feel sick, have been exposed to someone with COVID or other illness. Masks are not required. However, community members are welcome to wear one if you wish. We encourage everyone to take responsibility for their own health needs and to do the right thing when not feeling well, such as testing and isolating as necessary. As a student, it is important to take care of your own well-being. There are several opportunities in Hall to connect with others, including jobs within Housing and Residential Life. So you may work where you live or create and participate in one of our many groups. Our staff are available as a resource to you in each Hall community, but we all play an important role in our community. Should you experience or witness a bias incident, please report it as soon as possible to your CA, which is your community advisor, or submit a report to the Bias Response and Referral Network so we can provide support and follow-up. Knowing which resource to use and why at the university can seem really overwhelming. The Bias Response and Referral Network, or BRRN, is here to refer students, faculty, staff, and members of the public to appropriate support resources. The BRRN responds to bias incidents on the Twin Cities campus in ways that support those most impacted, promotes education and dialogue, and affirms the university's commitment to equity and diversity, free speech, and academic freedom. The BRRN does not have an investigative or disciplinary role in responding to any bias reports. We encourage anyone who has experienced or witnessed an act of bias to file a bias report, which is a link we will get shared with you all. An individual can file a report anonymously, or they can choose to identify themselves. The BRRN defines as an act of bias as an act of bigotry, harassment, or intimidation that is motivated in whole or in part by bias based on the individual's or group's actual or perceived race, color, creed, religion, national origin, gender, age, marital status, disability, public assistance status, veteran status, sexual orientation, gender identity, or gender expression. Thank you. I'm very excited to welcome you all to campus. And I'm going to turn it over to our next presenter, Gracie, who is a communications specialist at Boynton.
Hi, thank you, Katie. Good morning or Good day. I'm Gracie. I'm from Boynton Health, the university's health service for students, and I'll be telling you a little bit about what we do on campus. Boynton Health is dedicated to empowering students to take control of their health. With over 100 years of experience caring for university students, we understand that navigating a new healthcare system can be very challenging. That's why we're committed to making the process as smooth and accessible as possible, supporting you every step of the way. Boynton Health is a comprehensive college health service where you can receive almost all of the care you'll need while at the university. That includes a pharmacy, physical therapy, dental, eye clinic, gynecology, immunization, and a nutrition clinic. All of these clinics are located in one building right on campus with care teams who work together. And don't worry, our health providers are not students or grad students. All are accredited medical professionals with years of experience in their respective fields. The East Bank, Minneapolis location is our main clinic and offers all of the services I just mentioned and many more. We also have a smaller St. Paul clinic, which offers primary care, mental health, physical therapy, nutrition, and Gopher Quick clinic services. Our main clinic on East Bank is open Monday through Friday during general business hours. If you do need help outside of Boynton's hours, we have after-hours care information available on our website. We also have a 24/7 nurse line available. There are several ways to access care at Boynton. You can call to schedule an appointment, and some, but not all, types of appointments can be scheduled online. The urgent care clinic specializes in medical problems that should be seen in a more immediate way than regularly scheduled appointments. These conditions include severe headache, flu, frostbite, work injuries, nausea, and many others. We also have a 24/7 nurse line available, as I mentioned. You can call anytime if you have questions about symptoms, need self-care tips, or are unsure if it's time to see a doctor. The university does have an immunization requirement. All students born after 1956 are required to have the following immunizations: diphtheria, tetanus, and measles, mumps, rubella, which is distributed as a single MMR vaccination. You will need to locate the form on Boynton's website to self-report the dates that you've received these vaccinations. Once that form has been completed, you've satisfied the requirement and you're done. If you still need the required vaccinations or would like any of the other ones we recommend, they can be taken care of at Boynton Health as well. The Mpox vaccination is also available and recommended for those who meet the eligibility criteria, which can be found on the CDC website. You can call us with any questions. If you do need any of the required vaccinations or are interested in any of the vaccinations we do recommend, you can check out the link for our drop-in vaccination clinic. We're open Mondays and Wednesdays, and you don't need an appointment. The vaccinations available are listed on the screen, and you can also schedule an appointment to get a vaccination. We offer 2 quick care options to help you feel better as quickly as possible. Same-day appointments for the Gopher Quick Clinic can be made online or by phone. The Gopher Quick Clinic treats symptoms like COVID-19, flu, strep, and other minor conditions. For more serious symptoms such as chest pain, high fever, injuries, or cuts, you can visit urgent care for immediate attention. Both services are available during our regular business hours. So, what could you do to stay healthy and safe from COVID-19 and influenza? The COVID-19 is less of a concern for many of us than at the start of the pandemic, but there are still measures you can take to keep yourself and the university campus healthy. We recommend staying home if you're feeling sick, testing for COVID-19, and following isolation guidelines if you do test positive. We offer PCR testing for those with symptoms and sell rapid tests in our pharmacy. You can stay up to date with your COVID-19 and influenza vaccinations. Like I said, we do offer those vaccinations on a drop-in basis, available Mondays and Wednesdays. We also recommend keeping up with hygiene habits and washing your hands with soap and water on a regular basis. Boynton Mental Health provides a supportive, confidential environment where students can seek professional mental health help. We offer a range of services, including counseling, psychiatry, group therapy, and walk-in and urgent counseling. We also offer telehealth counseling appointments and have extended early morning and evening sessions available to best meet your scheduling needs. This support not only benefits the student's immediate well-being, but also plays a key role in long-term academic and professional success. And with a typical wait time of just 2 weeks, students can be seen faster than most other clinics. Boynton also supports several programs that promote health campus-wide. One of our largest public health initiatives is the Share the Air campaign. The university is a smoke and tobacco-free campus, both inside and outside. This policy prohibits the use of e-cigarettes as well. We're also working to address food insecurity on campus. Any student can receive fresh and healthy food for free. The food pantry is open 4 days of every month of the school year and located just in the Kauffman Memorial Union on the first floor, right behind the Goldie statue seen in the photo. One of our most popular and cutest programs is PAWS, which stands for Pet Away Worry and Stress. Every week, therapy dogs, cats, bunnies, and chickens hop or trot onto each of our campuses, providing animal-assisted interactions that help reduce student stress. Students play an important role in our health promotion efforts on campus as well. For example, we offer a health advocates program. Health advocates are student health resources located in residence halls, apartment communities, fraternities, and sororities. Boynton Pharmacy is staffed by pharmacists and support staff who are experienced in addressing student health needs. Located conveniently at our East Bank Clinic, our pharmacy offers a wide range of products tailored to the health and wellness of students and their budgets. Our pharmacists take time to educate patients about their new medications and are always available to recommend any over-the-counter products. You can also visit the Boynton Pharmacy website for an easy, secure way to transfer prescriptions or learn more about the products and services we offer. Again, there's no way to remember all of the information that I have shared, especially when you will need it. Feel free to visit our website, boynton.umn.edu, or send us any questions at our email, bh-quest@umn.edu. Feel free to scan this QR code for all of the information I've shared today, as well as much more, including booking an appointment and how to do so. Now we will transition to our Office of Student Health Benefits and have Greg Thurston, the Director of the Office of Student Health Benefits, explain the health insurance options in more detail. Thank you so much.
Thanks, Gracie. As Gracie said, my name is Greg Thurston. I'm the Director of the Office of Student Health Benefits. Could we advance to the next slide, please? So today I want to highlight health insurance requirements for the University of Minnesota, as well as some items related to health insurance in the United States that may be different from health insurance in your home country. Health insurance in the United States is complicated, even for those of us who were born here. In the few minutes that we have now, I can only give you a general overview of how it works. The booklet with all the health coverage information, known as a summary plan description, is over 100 pages long and is posted on our website. After this presentation, you'll likely have additional questions in the future. The Office of Student Health Benefits contact information is provided here, and I want to assure you that we're committed to helping you with any questions you have now or in the future. First, it's important for you to realize that unless you qualify for a waiver, the University of Minnesota requires you to be on either the university's student health benefit plan or the university's graduate assistant health plan. This requirement has been in effect for over 40 years and applies to all university students, both domestic and international. It's necessary so that you can focus on academics and not worry about whether you can obtain medical services if any health issues arise. Waivers from coverage on the university plan are only granted if you're remaining in your home country for the semester or have United States employer-based health insurance, or your home country has an arrangement with the university which qualifies you for a waiver. Only the countries of Oman, Saudi Arabia, United Arab Emirates, and Kuwait have arrangements allowing waivers. So if you do qualify for a waiver, you should email the Office of Student Health Benefits for assistance with the process. If you're a graduate fellow or graduate assistant with a qualifying appointment from the university, you should enroll in the graduate assistant health plan. The university pays a significant portion of the premium for graduate assistants, so your contribution is very low. At the beginning of the semester, your account is charged $207.56, and if your appointment is 50%, you pay no additional premium. If your appointment is less than 50%, you do pay an additional amount for the semester based on your appointment level. You must complete an enrollment form to enroll in the Graduate Assistant Health Plan. To enroll, you go to our website, which is shb.umn.edu, and then select Graduate Assistance, and then select Enrollment. You complete and submit the form to the Office of Student Health Benefits. I do want to point out that failure to actively enroll in the Graduate Assistant Health Plan would result in the graduate assistant being automatically enrolled in the student health benefit and charged its full cost of coverage. Graduate students without appointments and all international undergraduate students not qualifying for a waiver must enroll in the student health benefit plan. The cost of the student health benefit plan is $1,795 per semester and is billed to your account at the beginning of the semester. To enroll in the student health benefit plan, click Enroll Me on the insurance plan communication that was sent to your MyU account. The Office of Student Health Benefits does not recommend purchasing any additional insurance, and even if you choose to do so, it will not allow you to waive off of the student health benefit plan. In the United States, even with health insurance coverage, an individual may have additional out-of-pocket costs when seeking medical care. Copays are small fixed dollar amounts that are charged each time you go to the doctor or have a prescription, with the insurance plan then paying the remainder of the cost of the visit or prescription. With the student health benefit plan, when you have services outside Boynton, you may need to pay a deductible and coinsurance. Deductibles are annual dollar amounts which must be paid for services before the insurance plan begins paying for services. Coinsurance is a percentage of the claim that you must pay, with the insurance then paying the remainder. However, all the plans have a maximum annual amount of out-of-pocket expenses, so that once you reach that amount, the insurance pays 100% for all remaining eligible claims. And in our next speaker, Katie will give you some of those specific amounts. Additionally, the Office of Student Health Benefits has detailed information on its website showing coverage levels for different types of services for each of the health plans. Our plans are designed so that most individuals have very low out-of-pocket costs when obtaining medical services. Boynton Health is usually your lowest cost and most convenient place for medical care. In fact, most services provided at Boynton result in no out-of-pocket costs for those people who are on the student health benefit plan, as what would have been your portion of the cost is paid for through your student service fees, so that you have no out-of-pocket cost for the service. People on the graduate assistant health plan generally just have a $10 copay for services at Boynton. The medical identification card you receive from the insurance company will have their website information, enabling you to find other available in-network providers when needed, such as when you require immediate care when Boynton is closed, or if you require a service not provided by Boynton. Our insurance company is called Blue Cross Blue Shield of Minnesota, and the provider network is called Aware. You'll need your medical identification card when obtaining services or picking up prescriptions at places other than Boynton. If using a provider other than Boynton, it is important to confirm that they're in network before obtaining services, as you often must pay more out-of-pocket costs when utilizing providers who are not in network. Typically takes a couple of weeks to receive your medical identification card. If you need medical services prior to receiving your card, please contact the Office of Student Health Benefits for assistance with your coverage. We're here to assist you and help answer any questions you may have about your medical coverage. The next presenter is Katie Smith from Blue Cross, and she's going to give more detailed information about the plans and how to utilize your benefits.
Thank you, Greg. Good morning. My name is Katie Smith, and I'm from Blue Cross Blue Shield of Minnesota, your health insurance plan. Today, I'll discuss the health plans for both the student and the graduate program. Today, you'll hear about the health plan options that are available to you. We'll also discuss the group of providers that you can use, as well as unique services to support and help manage your health and your health plan. So first, I'll start with the health plan basics. As Greg mentioned, everyone on the plan, whether you're on the grad plan or the student plan, will receive an ID card in the mail upon your enrollment into the plan. ID card is important because it contains your group number and your ID number, and you must provide this ID card to your providers when you seek care. That way they can correctly submit the claim to us so that we can process the claim. The back of the ID card will have the website to your information, including the summary plan description that Greg had mentioned previously, as well as contact information for our customer service department. Next slide, please. And I know Greg had talked about this just briefly here, but I'd like to introduce you to a few terms that you'll see within the health insurance information. I'd like to start first with the deductible, which is the amount that you pay for care each year before your plan begins to pay. Coinsurance is the percent of cost that you pay for some services, and this is typically applied after you've paid your deductible in full. For example, the insurance plan will pay 80% of the charge. That leaves the student or the grad with the remaining 20%, so that's called coinsurance. A copayment is the small flat fee that you pay for some services, such as an office visit or a prescription. The out-of-pocket maximum is the most that you'll pay for covered services each year. So once this amount is reached, the plan will pay for all eligible services at 100%. And the premium is the amount that you're charged each year, or in this case, each semester, for your health insurance. Next slide, please. Thank you. So now that you're familiar with the basics of health insurance, I want to talk about the process that takes place once you have services with a healthcare provider. So the first step is you go into the doctor's office and you receive your care. You'll present your ID card. You'll pay a copay if applicable. Once your visit is complete, your provider's office will send a claim over to Blue Cross and Blue Shield of Minnesota. Once we receive the claim, we'll determine the allowed amount or the cost of the service. The allowed amount is a cost that's agreed between the insurance plan, Blue Cross, and the provider's office. Once we've determined that cost, we will pay the provider our portion of the claim, and we will send out to you what is known as an explanation of benefits. That explanation of benefits will show what the doctor submitted for the charges. It will also show our allowed amount, and it will show what you owe to the provider in the form of either a deductible, coinsurance, or copayment. You will then receive a bill from your provider's office, and you'll just want to double check that bill and compare it to your explanation of benefits to make sure that everything matches. If everything matches, you can pay the provider the amount that you owe to them. And of course, if you have any questions on the explanation of benefits or the provider billing, please contact the customer service number that's on the back of your ID card, but it'll also be listed on your EOB as well. Next slide, please. With both the grad and the student plan, you have access to our online member portal, which is known as Blue Care Advisor. Blue Care Advisor takes the guesswork out of managing your benefits. It's a comprehensive digital resource, and you can see the details of your plan and what's covered, but the best part is that it is personalized just for you. So this means that the information and features that you see are based on the benefits provided by the university. With Blue Care Advisor, you can access your benefits all in one spot, from the medical plan details to program information and prescription drug coverage. Blue Care Advisor pulls together your benefit programs in one place. There is also a mobile app that you can download that works with Blue Care Advisor. You can either use it on a computer or download the app. The app is great because you get all of your information on the go. But my favorite thing about the app is that you have access to a digital ID card, which is great, especially if you're waiting a couple of weeks for your ID card to come in the mail. Also with the Blue Care Advisor is you can know the cost of care before getting treatment. You can get help predicting your out-of-pocket costs before seeking care, and we'll even recommend providers near you to make finding care simple. You can receive support and important reminders about your care to help keep you on track with managing your health. Next slide, please. And now I want to talk about our provider network. So as Greg mentioned, Boynton Healthcare will be your best bet for receiving low cost, high quality care. If you do need to seek care outside of Boynton, you want to make sure that you're finding a provider in our network. So if you're in Minnesota, the network that you will use is the AWARE network. You'll want to use this network to find all of the providers in network by using our Find a Doctor tool, which is located out on our website. Again, those websites are listed on the back of your ID card. And it is important to stay in network because we have those agreements with the providers with the allowed amount. You end up paying less money for care within that network. If you do have to go outside of your network, please note that you will typically pay a little bit more for your care, and you may have to file claims yourself as well. So I certainly recommend staying in network. If you have any questions on that, we're certainly there to help you with our customer service team. So knowing where to go for care can be kind of confusing as well. Well, this is just a chart that shows your different options that you have with your plan, and it starts with the lowest cost providers down to the highest cost providers. So if you're not really sure where to start by calling your clinic. They may be able to connect you with a nurse who can help you address your concerns and help determine if you need immediate care. Some clinics may even let you have an e-visit with your physician online for information about a non-urgent medical issue. And just note that this may not be an option for all clinics, but it's certainly worth checking into. If you have any issues such as flu, a cold, maybe a sore throat, and you want fast, convenient care, I recommend using Doctor on Demand. So Doctor on Demand is our online provider tool that we partner with. And with Doctor on Demand, you can get a visit with a doctor from wherever you're at. So you can use your computer, you can use the app on your phone. But with Doctor on Demand, you can discuss your situation and get the advice you need, typically same day without waiting a very long time. And if you have a webcam, you can talk to them, face to face on a video visit. If you need care soon, but not today, it's recommended to call your provider's office and schedule an appointment. If you need care now, we recommend going to an urgent care facility for non-life-threatening issues. And of course, if you need care immediately in an emergency situation, you want to go to the emergency room, the closest emergency room. And just note, the more urgent care you need, the more expensive it may be. So I certainly, want to make sure you're aware to consider those other options first in a non-life-threatening situation. Next slide, please. So now I'm going to discuss the health plan in a little bit more detail for what's available to you. And I'll start by discussing the Student Health Benefit Plan. The Student Health Benefit Plan is a robust plan that provides a lot of coverage for typical services that are needed. It provides coverage for preventive care services, as well as illness and injury services. It gives you coverage for doctor on demand and hospital services, as well as emergency room and ambulance services. There is a deductible on this plan, so remember that's the amount that you pay first before the plan kicks in. So for a single person, that deductible is $250 per year. For the family, it's $500 per year. And the most that you'll pay on this plan for your out-of-pocket maximum is $6,250 for a single person, or $12,500 for the family. And your deductible and your co-pays and your co-insurance all apply to that out-of-pocket maximum. Next slide, please. Shifting gears into the Graduate Assistant Health Plan. The health plan for the graduates, there are two health plans. There's Plan 1, which is available to the graduates as well as their dependents. This plan has no deductible if you're using in-network providers, but it does have a deductible for out-of-network providers. So again, very important to stay in-network. This plan is great because you have just a $10 copay if you need an office visit, but it's only a $5 copay if you need a doctor on demand visit. The out-of-pocket maximum on this plan in network is $2,500 for an individual, or $5,000 for the family. All of your preventive care, as well as well child care, so that's preventive care for your children, that is all paid at 100% if you're using in-network providers. If you're using out-of-network providers, you will pay a little bit more for that care. So again, let's stay in network. If you have any hospital care or emergency room services, that is also covered there as well. The next slide will talk about the Graduate Assistant Health Plan, Plan 2, which is available only for your dependents. There is a deductible on this plan of $100 per individual or $200 per family. They also cover office visits after a $25 copayment. Again, you do have that discounted copay if you're using Doctor on Demand. Super great resource there. I don't want you to forget that. And then the out-of-pocket maximum on this plan is $1,000 per person, or $2,000 for the family. Again, this plan covers your preventive and well child care as well. Okay, I'd like to shift gears over to prescription drug coverage. And on this one, we'll go ahead and we'll start with the student health plan. So this student health plan uses the Boynton Health pharmacy. It provides coverage for preferred generics and preferred brand drugs. This plan does not cover any non-preferred or non-formulary medications, nor does it cover any specialty medications. It is very important to take a look at the formulary when needing a prescription drug to make sure that it is covered on your plan. And if you need any assistance with the formulary or for additional resources on patient assistance programs, we'd like you to contact Boynton Health Pharmacy for further assistance. For the graduate plan, both Plan 1 and Plan 2, there is a pharmacy benefit as well. They do cover the generic brands, or I'm sorry, the preferred generic and preferred brands. They also do provide coverage for non-preferred drugs as well as specialty drugs. This plan is nice because it also provides coverage for 90-day prescription fills for just two $30 co-payments. There are lots of in-network pharmacies, but you can also use the Boynton Health Pharmacy as well for this plan. And switching gears over to our health and well-being resources, as a Blue Cross member, you have access to several health and well-being resources. The first one is Learn to Live, which is our online behavioral health therapy program that provides you with confidential support. They use interactive lessons to help you explore situations that trigger negative emotions and give you tips and strategies to work through them. Learn to Live can help with stress and anxiety, including panic and social anxiety, depression, insomnia, substance use, and resiliency. You can visit the website there and use the code UMN to get started. And also just talking about Doctor on Demand again. So with Doctor on Demand by Included Health, You can receive fast, convenient care from a board-certified physician 24 hours a day, 7 days a week for many common medical conditions. You just need a computer, a tablet, or a smartphone. What's great about Doctor on Demand is you also have access to licensed psychologists and psychiatrists, and you can schedule next day appointments with them. So again, if you're covered under the graduate plan, you pay just a $5 copay. And any dependent that's covered under Plan 2 pays a $10 copay. Those of you that are covered under the student health benefit plan will pay just a $10 copay. You can visit that website there, or you can download the app from your Play Store to get started. Our maternity management program is a great program for expectant mothers because healthier babies begin with healthier pregnancies. And our maternity management program can help. A maternity nurse provides one-on-one support during and after your pregnancy to help prepare you for your new arrival and provide guidance on staying happy and healthy after your baby is born. The best part about this program is upon enrollment, you receive a gift card in the mail that can help offset some of those baby expenses. We all know that diapers are very expensive. So we always recommend contacting customer service or the phone number on the screen there to get started with the maternity management program. And lastly, I just want to discuss our quitting tobacco and vaping program. We know that quitting tobacco and vaping is hard, but we've got your support. A wellness coach will work with you to develop a quit plan that's tailored to you, that helps you identify your potential hurdles, can help create strategies to manage your urges, as well as offer online resources to help you keep on track. So please contact our customer service or call the phone number there listed if you need help quitting tobacco or vaping. And we're here to help. Our customer service is available Monday through Friday from 7 to 8 p.m. Customer service number is listed there. You can also log on to the website on the back of your ID card to access our Find a Doctor tool. But I just want to mention too that with our customer service, we do have interpreter services available if you need help with that. We're certainly there to help you any way that we can. And with that, I just want to say thank you, and I will turn it back over to the ISSS. Thank you.
Thanks, Kitty. My name is Shima Li. I use she, her pronouns, and I'm a part of the Culture Corps at ISSS. As a reminder, there are lots of ways to connect with ISSS and the partnering offices on this webinar. If you have specific questions about your situation, please email those to the appropriate office. We will share their contact information on the following slide. For right now, here is a reminder of how to connect with ISSS. For new students, please email issnew@umn.edu. You can additionally find information on our website. Also, you can follow us on Instagram, that is ISSSUMN, for more information and updates on events. We have our fantastic winter break social hours as well. From now on, we still have 2 events on January 13th and 17th. Please check the link to see the details, and you are welcome to join us then. So I will now pass to you to introduce our next event.
Thank you so much, Shiman. So hello, everyone. We're glad that you're here. My name is Jose Go by he, him, his pronouns. And we're excited to share that the GE event is coming very soon, and we're lining up to support you throughout this journey. Our next event is the new Global Gopher Welcome and Small World Coffee Hours dinner, which will take place on January 24th, 2025 from 2 to 6 p.m. at the University and Recwell and Recreation Center. Your U-Card should be able to access the Recwell Center by then. It is a fantastic opportunity to meet new fellow students, connect with international student leaders, and gather valuable tips and help you to thrive in the University of Minnesota. If you're interested, don't forget to register through the link that will be available in the source. So next, I would like to pass the floor to Anita to lead the Q&A portion of the Health and Wellness webinar.
Thank you so much, Youth. So we're now transitioning into the Q&A portion of the webinar. I know a lot of you have been submitting questions through our Q&A session, and Marina has been assisting in answering the question. Appreciate that. And we will actually start with a lot of questions submitted through the registration sheet, and then we will gear towards to answer questions currently submitted in the Q&A section. As a reminder, there are many ways to connect with ISSS, as Shima mentioned, and the partnering office featured in this webinar as well, as you can see on the screen. If you have any specific questions about your situation, we highly encourage you to email the appropriate office directly. All of the contact information is listed on the slides, and I believe we will drop the links of all of them in the chat pretty soon as well. So to start, we will go over some of the questions submitted during our registration process. So the first question, I will hand it over to Gracie from Boynton Health. I know you briefly touched on the question a little bit, but student asked, as a new graduate student who arrived in December, when can I take flu vaccine in Boynton?
Yeah, that's a great question. Our flu vaccinations are available at that drop-in clinic that I mentioned, which is open on Mondays and Wednesdays from 8 to 3. If you have additional questions that go along with getting that flu vaccination, we do recommend making an appointment where you could also receive it. We will also be having a flu clinic on February 4th at Kaufman Memorial Union. There will be more information on our website about that shortly. But yeah, the drop-in clinic is a great resource.
Thank you, Gracie. So our next question is for Greg and Katie from Blue Cross Blue Shield. How can I find out if my insurance covers a specific service at Boynton? How can I determine the amount of my copay?
So most services at Boynton have no copay for people on the student health benefit plan. If we're talking about the graduate assistant health plan, there is a $10 copay, so it's generally going to be a $10 copay. If you're talking about the student health benefit plan, if you remember, there were talks of deductibles and out-of-pocket maximums and co-insurance and all that. All that ends up getting avoided for 95% of the services at Boynton, because your student service fees ultimately pay that. If you have a service at Boynton, I mean, I guess ultimately you just ask when scheduling the service, is this service going to be covered by student service fees? And again, unless we're talking about prescriptions or durable medical equipment, physical therapy, I mean, unless we're talking about things like that, the answer is almost always that it's covered by the student service fees.
Thanks, Greg. And our next question is for Katie from Housing. So are there any meal plans included with housing, and are they mandatory?
Thank you. Good question. So all of our residents who live in a traditional residence hall are required to have a meal plan. There are a number, some options. Our meal plan currently consists of unlimited meals, which means that you are able to access the residential dining centers as many times as you want during the day, during the week. And then really the difference between the meal plans is in regards to what we call dining dollars, and that is a declining balance that would be on your U card that you can use in the retail locations, such as the Kaufman Memorial Union Marketplace. So there's a Panda Express, Einstein's, a Starbucks, and other retail locations across campus. If you are a resident in any of our apartment buildings, you are not required to have a meal plan, as you have options for cooking in your own space. And so we don't require a meal plan. However, again, the traditional residence halls is required. All students, whether you live with us or not, are also able to purchase a meal plan if you would like to have options while you're on campus.
Thank you, Katie. I saw a question in the Q&A section, I believe, for both Gracie and Greg. So I'm on employee health plan with Medica. I was wondering, can I still access health service at Boynton Health?
So here's the employee plan. Yes, but the issue there is that some of the employee plans require you to designate a primary clinic. And so if you haven't designated Boynton as a primary clinic, that could be problematic from a billing point for you on some of the plans. We as university employees have 4 different plans that we could enroll in. And so if you're in the one that requires you to designate a clinic, if Boynton's not your designated clinic, you could have some issues with billing.
Thank you, Greg, for that. So I noticed in the chat there's questions about public transportation as well as if there's a general tour available for the new student. Based on my knowledge, I know there unfortunately will not be a tour, but I do know there might be some tips and tricks our student leaders are actually willing to share specifically towards public transportation. And I will also be able to share the links to all of our campus maps into the chat while our student leaders are answering the question. So this actually aligns with one of our submitted questions through the registration sheet about public transportation. So the student asked, I want to learn how to navigate the public transportation system and as well as about writing groups. So I know, Shima, you may have a good answer for that.
Yeah, thank you, Anita. So for the question about public transportation, we have our Gopher Chelfer campus bus and Gopher tunnels and the one-to-one bus between campuses. Those are the St. Paul East Bank and West Bank. So for 122 and 123 campus buses, that is between East and West Bank campuses. And there is 124 bus just for the St. Paul campuses. So please download the application, the mobile app of the Gopher bus. Then you can navigating all the maps of those buses. And please pay attention to the bus schedules, especially for weekends and holidays. Hours might be different from workdays. And for Gopher Chelfer, please pay attention to the schedules in different seasons. It could be found in the link provided later in the chat box. And yeah, for public transportation system in the Twin City area, please activate your U card at the beginning of each semester by tapping it on the subway or bus kiosk. Then you can access to all the public transportation tools in the Twin City area. And yeah, for the question about the writing center, we have our student writing support provided. It is located in the Nicholson Hall. You can schedule a time with the student writing support, both online or you could you could go there in person. But please remember to schedule previously to get writing resources and also consult with one specific consultant. You can select it on the web. You can select on the website. So yeah, I will share the link of the student writing support, that is writing.umn.edu. And yeah, hopefully I have answered your question. Thank you.
Thank you so much, Shiman. And feel free to continue submitting your questions throughout the Q&A session, or else I will just continue with our pre-submitted questions throughout the registration sheet. So another question is for Gracie from Boynton Health again. What should I do if I get sick or injured outside of the clinic hours?
Yeah, that's a great question. So Boynton is open from Monday to Friday during general business hours, but in the event that you are sick or get hurt outside of those hours, we do have a 24/7 nurse line available, as well as after hours care information on our website that can direct you to any local clinics. I can send a link for that. But those are our current options for aftercare or for after hours care.
Thank you so much, Gracie. If you can drop the link into the chat, that would be great. And our next question is for Kitty from housing. What should I bring with me and what items are prohibited in housing?
Great question. It's often that folks overpack and bring more things than we can fit into your room. And so the most important things to bring with you are your personal items, your clothing, your toiletries, bedding. But really, once you get to your space, you can also, look at if you need to purchase something additional. But in your room, you will have your bed. It's an extra long twin size. So if you are bringing bedding, it's important to know the size. There's a desk, a chair, garbage and recycling bin, and a dresser and wardrobe. So it is really just your personal items that you need to bring. Again, trying to pack smarter so that you're not bringing so many things that won't fit. The other thing, as far as what not to bring, is really we don't allow things that are going to potentially be harmful to you or the community. And so that would be like anything that might cause a fire. So no candles or anything with an open flame or open hot burning piece is not allowed. On our website, I think the link was shared. We do have a full list of kind of what is provided, as well as some suggestions on what to bring, and then also the items that are prohibited, including alcohol. So if you have more questions, certainly refer to that list or reach out to us.
Thank you so much, Katie. I completely agree with pack smarter, not too much. And that kind of like ties back to one of the other questions that I have so far for our student leaders, because students are really worried about the winter here in Minnesota. So they're wondering if you all have any tips and tricks for that. And in addition, if there are any resources or advice that you would like to share with new students, especially about how to stay healthy and well. And if there's any specific campus resources that you've been using personally and you found it helpful, feel free to share it out. Don't gatekeeping. So I will pass it on to our student leaders. You seems really ready, so I'll pass it on to you.
Thank you, Anita. That's an excellent question. I know winter is already beginning. It's getting cold, and right now the temperature is always -Celsius for a majority of us. And here we call them Fahrenheit. It's gonna be fun. But yes, in order to actually stay a little bit healthier and well during the winter, I strongly recommend that there's a few resources that I often use. One is actually, you can actually choose to join different sport club and activity within the Rockwell Center. It's a very good way to stay active during the cold winter. It's build your immune system. It helps with reducing cold. So you will be able to find different sport club and activities that you can join, and oftentimes at a very low cost. And some of it are often for free. They should oftentimes have a trial sessions or trial thing to do. I did a very fun rock climbing activity early this winter. It's actually super engaging. There will be a lot of other things that is available for you as well. We have already talked about the Nutrition U Food Pantry, which is a good source to actually find nutritious and healthy food. We got to stocked up this winter preparing for the cold. It's super helpful to have that once every 2 weeks, I believe, in Kaufman Memorial Union. And if you feel like there are additional mental stress, Boynton Mental Health and Services is always a good place to also contact and engage, because this is when you can actually have some time to process what is going on. If it's homesickness, it's financial stress, things that is actually at the back of your head and kind of make you feel unnecessary anxiety or anxieties overall, I strongly recommend utilizing the resources as much as possible. One of the biggest thing I often do is find a good friend group. That is some things that I find super helpful if you're navigating the cold winter. There's nothing better than having a hot choco at one of your friend places to chill out and actually looking at the snowfall. I strongly recommend that activity as a way to produce both mental stress and a good hot beverage on a cold day. So back to you, Anita.
Thank you so much, Yus. If there's any one of other student leaders would like to chime in, feel free to do so. Or also I'll keep asking questions from our registration. All right. So our next question is actually for Greg and Katie from Blue Cross Blue Shield again. Is the health insurance applicable before the school starts, or do I have to pay extra for it?
I'll take that. The health, you don't have to pay additional. The health insurance will start on it officially for the semester starts on January 21st for the student health benefit plan and February 1st for the graduate assistant health plan. Now, if you need services prior to that time, contact OSHB and we can get you enrolled effective the day that you come, effective as of the date that you arrived into the country. And ultimately, there would be no additional charge for that extra time period if needed.
Thank you so much, Greg, for that. So our next question is back to Katie from housing. How can I find housing if all on-campus spaces are filled?
Yeah, so we do, like I mentioned earlier, we do have some spaces available. However, if you're looking for off-campus housing, we do have an off-campus housing listserv on our website, where you can go and search, for different amenities or spaces that interest you or to fit your needs. These particular listings are folks that have worked with the university and are in good standing. They are not university affiliated. But it is an option for you to look at for the housing options. And then really utilizing the off-campus housing office that is on campus. They have a lot of resources available. If you are also looking for assistance with, reading through a lease and identifying if there's any things that you should be concerned about, they are happy to walk through that with you. And so I would definitely encourage you to utilize that office as well.
Thank you so much, Katie. And Amora has dropped the link to the off-campus housing site from the housing website, as well as if Amora, you could find the office for living off campus, that would be great. And you can share that in the chat as well so that you can contact the OCL for more information living off campus. So our next question is back to Gracie from Boynton. What documents or ID should I bring or prepare when visiting Boynton Health for services like picking up medication or attending a counseling session? And also, can Boynton Health clinics provide doctor's note to submit to a professor for requesting accommodations or as evidence of illness?
Thanks for those great questions. So for absences, we typically do not write absence notes. I can send a link to our webpage regarding this policy. Most of the time, professors will not ask you for a medical note anyway. But in the event that they do, we have information to connect you with. Regarding documentation for picking up a prescription or going to an appointment, you will need an ID in addition to your insurance information. But you can find more information on our international students page, which I'm sending in the chat as well. Thank you.
Thank you, Gracie. So our next question is for all of the student leaders. If you have any insights, feel free to share. What support is available if I experience homesickness, culture shock, or academic stress here at the university? Is there any specific either resources or organizations or events that on the top of your head that you would like to share with our students?
I think I can go first for that one. As one thing that I strongly recommend you check out is Gopher, which is the best place to find different student group, specifically identity-based group where you can actually experience people from the same culture who share culture similar to you, where you can engage in their activities. You can also actually explore some different events that take place around campus. We strongly recommend you are engaging with student community because the University of Minnesota houses a lot of a lot of cultural diversity within the space where you can actually engage and learn from one another. One thing I often tell people too is that be a lifelong learner and looking at the challenges of new cultures as a form of learning, exploring this process and experiences in the University of Minnesota as a form to engage and explore, understanding new cultures, but at the same time embracing your own and sharing your own in space as well. One interesting fact that I often do is also join study group. I'll create my own study group just to get past each semester. Strongly recommended finding friends who actually share the same study habit as you, sit down, find space in a wonderful and diverse space within the university, either at the library. Each of the library have dedicated group study sessions where you can book just to sit there and actually study together. Has been a very helpful process.
Thank you, Youth. I can add on to that. I think homesickness, culture shock, and academic stress are very normal, especially for new international students. And I would recommend, if academics are very overwhelming, the Academic Success Center would be a great option. It offers workshops and time management, studying skills, and one-on-one tutoring on like various subjects. I especially used it for my freshman year. It's really great if you're taking beginner classes. On top of that, to feel more connected, joining a cultural or a student groups through the Multicultural Center or any student center, it would be really helpful. And I'm pretty sure there's like thousands of student groups that you may find at least one they may feel connected to.
Thank you so much, Amora. Shiman, go ahead.
Thank you. Yeah, I would add on, like, if you feel stressed about your KDME part, please talk to your program coordinator. And for graduate students, yeah, you could make a good plan by talking with your director of graduate studies. Then you will have a lot of new ideas about like how to plan on, yeah, what are the next steps for your study, and yeah, what are the steps for like finishing every step of required by your program. So that is very important to know ahead. Thank you.
Thank you so much, Shiman. So there's a question in the Q&A session asking about when can we get our U card and how can we use the buses until then. So yes, you said like you came across with a pass, and we do offer a Metro pass for all of our new coming students before you have the access to your U card, which is available from January 1st to January 20th. So technically you would still be able to access those passes and just use them to get on the Metro transit. And in terms of when can you get your U card, once you arrive on the office, feel free to go to the U card office and you can pick up your U card or request to have your U card by then. But before that, remember to submit your picture for the U card through the portal that UCAR office offer. And I'll just ask our student leader to hunt for the link and put it in the chat. But remember to do that before you go to visit the UCard office, and then you can pick up your UCard directly from there. But even without UCard, for all of the Gopher transit Shiman shared earlier, all of the campus buses, including like 121, 122, 123, you are free to get on those buses even without a UCard. So hopefully that answers your question, and you can still use Metro Transit with all of the free passes as well as the campus buses. All right, so our next question is back to Boynton Health, to Gracie. So are there counselors or therapists available who speak my language or understand my cultural background?
Yeah, absolutely. We do have interpreter services available in our main clinic, and that extends to mental health services as well. We have a wide variety of counselors who are specialized in a variety of backgrounds. And during the mental health intake process, you can be connected with a counselor who best fits your needs. I will send the link to the interpreter information, which should get you started with that process.
Thank you so much, Gracie. And we actually only have one question left for all the registration. So that question would be for Katie from housing. Am I allowed to move out during the semester? If so, will I receive a refund for the housing fee?
Good question. So once you move in, our agreement that you agree or sign is a binding, legally binding agreement. And so once you move in, you would need to go through our contract release process, which the link has been shared with you all. Once you've moved in, you would complete that process. If you are approved to move out, we would prorate the charges based on how many nights you've stayed with us. But not all contract releases are approved. And so again, a lot more information. It is very circumstantial depending on your situation. And we do have staff that review it very carefully to make the best decision possible for you and for all of us as well. So again, I would refer to that process in terms of that release for the refund.
Thank you so much, Katie, for that. And I noticed our colleague was not able to find the off-campus living offices contact information, so I was able to find it, and I will just share it into the chat. So that's not really related to what Katie just answered, but back to her previous answer to the off-campus living, that's where you're able to find those resources. And if there are no more live questions through the Q&A session, then we will just move on to close up our session. Doris, if you can proceed into the next slide, that would be great. So thank you for attending our webinar today. Thank you so much for attending our health and well-being webinar today. We have answered as many questions as we can, and hopefully we've been able to address your questions as well as concern today. So if not, again, please know that there are many ways to connect with us, as well as receive up-to-date information regarding health and well-being. So for any questions or concerns related to health and well-being, for any questions or concerns related to housing, feel free to contact the Office of Housing and Residential Life at housing@umn.edu. And for any questions specifically about COVID testing, vaccine availability, or on-campus health services, please contact Boynton Health directly at bh-quest@umn.edu. For questions related to health insurance, email the Office of Student Health Benefits at umshbo@umn.edu. For any questions specifically about student health benefits plan as well as graduate assistant health plan, feel free to call Blue Cross Blue Shield Minnesota customer service team at 1-866-873-5943. And they also encourage you to register on their website, and you will help me to drop that link in the chat as well. And you can always contact us at ISSS. For all of the new students, you can contact us as issssnew@umn.edu, or if you're a current and returning student, you can contact us at isss@umn.edu with your questions or concerns. And I would like to express my huge gratitude to all of the panelists who joined us today to make this webinar happen. Katie from the Housing, Gracie from Boynton Health, Greg from Office of Student Health Benefits, Katie from Blue Cross Blue Shield of Minnesota, as well as all of our ISSS staff here with us today in this webinar. And that's all for our webinars, and we will end with a video about Boynton Health Services. And thank you all so much again for attending the Global Gopher Health and Wellness webinar. We look forward to seeing you on campus soon.
Welcome to the University of Minnesota. We are Boynton Health, and we're excited to help you get a strong start to your college career here. We understand that it can be overwhelming to take control of your healthcare needs. That's why we're committed to helping empower students like yourself. There are a variety of clinics you can choose from here at Boynton, from primary care, urgent care, Gopher Quick Clinic, dental and vision services, gynecology and gender care, nutrition services, physical therapy, immunization, and a pharmacy. And as a student, you can access most of these services at little to no cost.
So now that you know what Boynton Health has to offer, you might be wondering how to get treatment. There are many ways to access care. You can make an appointment by calling, stopping by in person, or visiting My Boynton online patient portal. Through this patient portal, you can access immunization records, receive test results, and update your patient profile. Not sure what kind of help you need? No worries. We have a 24-hour nurse line available to help you access the right care.
Of course, after you make your appointment, you might be worried about how much it will cost. As a college student, finances can be a huge concern. Most students can receive care at little to no cost. You must meet 2 criteria. You need to pay the student services fee for the semester that you're enrolled in, and you need to be on an insurance plan, either a private plan or the university's plan. Most students must have insurance to be able to attend the university.
The plan offered through the university is called the Student Health Benefit Plan. It is charged to your student account alongside the student services fee and tuition. The Student Health Benefit Plan fee varies yearly, so be sure to check out our website for the most up-to-date cost. You might choose to opt out of the Student Health Benefit Plan and might be worried about paying for Boynton's health services. Don't worry. Regardless of what kind of insurance you have, most students can be seen at our clinic at little to no cost.
Boynton Health also does a lot of public health outreach across campus. We work to promote the physical, social, and emotional well-being of all students across campus inside and outside the walls of the clinic. Be sure to take advantage of programs like Nutritious You, Food Pantry, and Gopher Chauffeur. If you're feeling overwhelmed, you can put away worry and stress with Pause.
If you're a student living in a residence hall on campus or a fraternity and sorority, talk with your student health advocate. These students are first aid and CPR certified and can help with other common health related issues by referring you to other campus health resources and sharing information. These students provide cough drops, bandages, safe for sex supplies, cold and cough and pain medicine. Other health promotion resources also include stress check-ins, safer sex supplies, and Recovery on Campus, which is a student group that provides support and resources for university students in recovery through social activities and regular meetings. Boynton Health offers individual therapy, couples and group therapy, and student counseling services. We also offer stress check-ins. Stress check-ins provide an opportunity for you to talk through stress in your life, come up with solutions, and to connect with campus resources.
You can find us on the East Bank Minneapolis campus and the St. Paul campus. We're open Monday through Friday during general business hours. Don't hesitate to give us a call or visit us at the clinic. You can find more information at boynton.umn.edu.
Be sure to visit MyU to fill out the immunization form and the insurance declaration form.
All right, that's it for our session. Thank you so much for everyone for attending, and I will see you on campus, and have a good rest of your day. Bye.